It's about trying to put doctors, trainees and consultants in situations which are either rare for them or also in situations that, although may not be that rare, the outcome of can be catastrophic if not treated properly. So to try and just give them difficult experiences and then to learn from it. It enables us to look at teaching human factors to both doctors and nurses.
You are on a shift in A&E, you're the registrar.
Yeah.
You've been asked to review a young woman who's come in via ambulance with acute abdominal pain and diarrhoea. The consultant's busy with a major trauma that's just arrived in A&E, and that's all you know.
Okay.
Do you want to?
So I'm A&E registrar on a typical A&E shift. Consultant's busy with a trauma call. There's a young lady who's come in who's got abdominal pain and diarrhoea, and she's come in via ambulance.
That's right. You ready?
Yes.
This lady has been here a very short time. It's
Okay.
Michelle. Right, Michelle, this is the doctor. She's in a lot of pain. I just need someone to sort of sort out her pain, if you don't mind.
No worries. We're in recess, so can I get you just to pop some monitoring on this young lady, and I'll just have a little chat with Michelle. Hi, Michelle. I'm Danielle, one of the A&E doctors. How are you?
Not well.
No. Tell me what's been going on.
I've got really, really bad tummy pain.
Okay. And when did it start?
Well, it's been like maybe half a day.
Okay. And whereabouts in your tummy are you getting the pain?
It's a stressful situation, and that's what makes it realistic. So the realism actually comes often from being videoed and filmed and being watched by their peers and the faculty that train them, that actually causes them to get stressed. And that stress gets them to buy into the situation.
My heart did start to go up a little bit as the patient's blood pressure started to drop, and as the patient's heart rate went up, I'm sure mine did as well. So it does feel, it makes it feel a little bit more realistic in your terms of decision making, how urgently you need to act upon things, and you only really get that with things being done in real time. So I think it's a really valuable learning experience.
The production gallery enables us to make the sim man do whatever we want, obviously within his capabilities. So we can talk through microphones.
Ow.
Sorry.
My tummy really, really hurts.
All right, my love. Well, the pain relief is coming, okay? We're just making sure that the drip's in place, in the right place, so that we can get you the best pain relief that you need, all right?
We're also able to adjust sort of visual things that Sim Man's able to do, such as close his eyes. He can go blue if he's not getting enough oxygen. He can shake. He can sweat and cry, but also we can adjust the physiological parameters, so things such as like blood pressure and heart rate we can adjust, so he has less of a blood pressure and is not breathing as much and his heart rate's slow or fast, so we can adjust all those physiological parameters as well. It's really important that it's safe, and we say to all of our trainees that the training is confidential, and what happens within the training experience is 100% confidential. The reason being is that we want them in the debrief. So after every simulation, we have a period of time where we discuss what happened, and we want people in that debrief to be as honest as they are, or as they can. And if they're not honest, they may not learn what they're going to need to learn. So they need to have no fear that they can talk about what they did or what their colleagues have done without worry that we're then going to use it to discipline them, or take it to their educational supervisor to make sure that they have restricted duties. So people can make mistakes, and this is a safe place to make mistakes because no damage is done. And when if they do make a mistake, they can go away and learn from it.